There's a bunch of disparate symptoms that we don't think are connected, but actually are. And so when people go to their primary, they'll get this one symptom treated with this medication, and then they'll get referred out to another specialist that'll treat another symptom with a different medication. And so no one's putting pieces of the puzzle together. No one's looking at the whole body and going, this is why you're having all these different symptoms and all these different systems. That's a clue usually for us when someone walks in and says, I've been everywhere, I've been to all these doctors, I can't figure it out. I'm like, you're probably autoimmune. That's why. If you've ever wondered, why am I so tired all the time? Even when my labs are normal, you're not alone.
And if you're dealing with symptoms like brain fog, hormone imbalances, or autoimmune issues that no one can fully explain, you're in the right place.
Hi, I'm Dr. Justin Lane, doctor of acupuncture, Chinese medicine, and functional medicine.
And I'm Kay Michelle Schroeder, a national board certified health and wellness coach and a certified autoimmune disease specialist.
Together, we help you uncover the root causes behind your chronic health concerns,
so that you can finally understand what's going on and take back control of your health. Hey, Justin, how are you doing today?
Doing fantastic, Michelle. How about yourself?
Really good. Thank you. I just wanted to introduce our topic today. Today, we're
excited about this.
Yeah. I've been thinking about some of our clients. They'll call and they want to come in because they have weight gain. They have really a lot of fatigue. They're not sleeping good. And they always want to come in and get their thyroid checked out because they think the reason they can't lose weight or that they feel sluggish is because they must have a thyroid issue. And then you do your testing and things like that. And we find out they have an autoimmune condition, maybe more than one. And so today I really like to just answer the question of, okay, so I have autoimmunity. Now what? What do I do? Or I feel like crap and my labs say I'm okay because I've been taking thyroid medicine, but I still don't feel good. Let's just talk to people who have Hashimoto's or other autoimmune issues and talk about what we're going to want to do about it.
Yeah, absolutely. I think this is the most common autoimmune condition. The symptoms are what get people to a primary care doctor initially. So if we're talking thyroid, you're going to feel tired. You're going to feel constipated. You may have brain fog. Your memory may not be working. You're gaining weight. Your hair is falling out or thinning. You feel cold. You just don't feel right. And that's what most people will recognize, that I need to go to a doctor. And typically we start with primary care doctors with those symptoms. In primary care medicine, they do minimal testing, enough to really put you on a medication, maybe diagnose at a very superficial level what's going on. Usually a doctor will run at one or two of your thyroid markers in your panel. A panel is actually 9 to 12 markers, but insurance only pays for one or two of those, which lead to the medication. So most people start out in primary care with symptoms, get a medication to treat those symptoms. That's the path that most people stay on, quite frankly. Most people don't question anything other than, I'm taking a thyroid pill. I think I have a thyroid thing. The doctor said take it, so I take it. And for many people, that's how the next 5, 10, 15, 20 years go, maybe with some increases or switching medications along the way. But you're basically just scratching the surface on what's happening. So for those people that does not work for, meaning you take the medication and you still feel lousy, that's usually when people start to get more curious about what's happening or not happening, as the case might be.
With women, it's the curiosity really peaks when they cannot lose weight. That's a common one.
A number one concern. Yeah. People come in and say, I'm gaining weight, or I like to gain lightness back, not lose anything. But point being, yes, we're gaining weight and we don't know why. And we're doing everything we think we should. And then people end up in the clinic going, I don't know what to do. I'm exercising. I'm eating what I think is good. And I'm still not losing, or I'm still gaining. And so, for many women, that's the first start. You have other symptoms usually. It's chronic I don't feel good-itis. There's a lot of different symptoms that you can start developing. But the bottom line is, when you're going to get the symptoms treated and then you still feel lousy, that usually piques the curiosity. There's something else going on here that's deeper than what has been looked at previously. And
but
that's usually our starting point.
If you've been told your labs are normal, but you're still exhausted, inflamed, foggy, or you just don't feel like yourself anymore, I want you to know something important. There is hope. One of the biggest things I see in women with autoimmune disease and chronic symptoms is that they've started to believe this is just how life has to be now. But often there are underlying patterns and triggers that have simply never been identified or addressed. That's exactly why I created my free guide, 5 Signs of Hope. In it, I walk you through some of the most common hidden drivers behind autoimmune symptoms and chronic health struggles. And more importantly, what you can begin doing about them. Because your body's not broken and healing is possible when you understand what it needs. You can download the guide for free at the link in the show notes. Can you explain a little bit more about what autoimmunity is and what's actually been already going on behind the scenes before the symptoms develop?
Yeah. So basically, autoimmunity is when the body is attacking self-tissue. It's tagging it, and then it's destroying it over time. We don't know the exact causes of autoimmunity. We have several. There's different factors in autoimmunity that in terms of what can lead to it. But essentially, you lose tolerance of your immune system and you start to have symptoms. And often people are like for Hashimoto's, for example, which is the leading cause of hypothyroidism. So for everybody out there who's been diagnosed as hypo or low thyroid, 95% of the time, the cause is an autoimmune attack on the thyroid gland. And most people don't know that because primary care is not evaluating that. They're treating the symptoms with medication. They're not telling you what's causing it. So this attack happens slowly over time, many months and years. At first, your immune system will put an antibody on your thyroid gland, which is like a tag or a flag or a Post-it note, and it starts to mark it for destruction. Eventually, there's a threshold that gets reached where you have a trigger, and that's the key, is identifying and removing your inflammatory triggers. They're different for everybody. For some people, it's the food they're eating, and that furthers the attack on the gland. It reacts with the immune tissue, and it starts to progress autoimmune disease. There's other triggers, basically, but that's essentially what it is, Michelle, is when the body starts to not distinguish between self and other. It starts to attack its own tissue for multiple reasons, and that's when you start to develop symptoms over time. But that can happen for months and years before your first symptom. So there's 3 stages of autoimmunity. Stage 1 is silent, what we call remission. No symptoms in this stage, but you might be making antibodies for months and years before your first symptom. It's an iceberg under the water, essentially. Most people don't know, so they don't go to a doctor. It's only in stage 2 when you have what we call reactivity or a flare-up, you have your first symptoms. Now, in my case, I'll tell you a story. I developed ulcerative colitis, which is an autoimmune condition. I didn't have symptoms of that until my early mid-30s. That was my first flare-up. I was studying literally for my board exams, and I started having all kinds of digestive issues, and that's when I got assessed and realized that's what it was. There is no age per se. There's times of life, stage of life. There's triggers when things can express. But in my case, I didn't have symptoms till early mid-30s. And then in case of ulcerative colitis is diarrhea, a lot of mucus, a lot of blood. So it was urgent to get it sorted out. And so that's what gets people to the doctor usually is stage 2. Now we have symptoms. We start going to primary care usually first. We start treating symptoms. And then there's a progression. There's stage 3, which is now tissue destruction. And so that's the end stage of autoimmunity. If we're using the thyroid as an example, at this point, the gland has been attacked to death by the immune system and it's failed. So now you can't produce your own thyroid hormones on your own. You need to take medication. And that's where most people sort of live, is just in that medication world and leaving it there unless they're curious and they're not feeling well. Just by doing that, we start to look at thinking outside the box with how to address this, because in primary care, the way they address autoimmunity is purely medication. It's medication and then more medication, essentially. Medication, in this case, for your thyroid, and then maybe more medication to suppress your immune system so you make the symptoms go away.
Yeah. And I
long term,
I just want to say there might be people out there that don't have Hashimoto's or don't have thyroid, but are wondering, why don't I feel good? My labs are normal. Yeah. I know that for me, I also have been diagnosed with an autoimmune disease. And I know for me, I went to my primary care physician many times for digestive issues. I went to my dermatologist many times for skin rashes, things that would happen on different parts of my body. Finally, on the top of my scalp, I had a lot of lesions. Luckily for me, I didn't have to spend too much time digging out what was going on. I had a lot of fatigue. I had problems with recovering after exercise. I was in my mid 40s and I thought, gosh, I'm getting old. I don't feel as good as I used to. And I couldn't figure out why. But since then, I've talked to a lot of people who have autoimmune issues, and they've been through the rigmarole. Like, they've literally been told by their doctor that it's all in their head. There's nothing wrong. They've been treated for several different conditions. Maybe they're taking a medication for digestion, another medication for inflammation, another medication for pain. That's another thing. I had a lot of joint pain also. But just tell me a little bit what happens in primary care that makes it so difficult for people to get a diagnosis that may be searching and searching for years. Because I've heard it's 5 years on average that people are going to physicians. By the time they're done, they feel like their family doesn't believe them. They don't hardly believe themselves. They wonder that if they do have some kind of hypochondriac condition or something. So what's going on with that? Why does it take so long to figure it out?
Yeah, primary care, everybody works in silos. So no one talks to each other. These are classic autoimmunity presents just like you described. There's a bunch of disparate symptoms that we don't think are connected, but actually are. And so when people go to their primary, they'll get this one symptom treated with this medication, and then they'll get referred out to another specialist that'll treat another symptom with a different medication. And so no one's putting pieces of the puzzle together. No one's looking at the whole body and going, this is why you're having all these different symptoms and all these different systems. That's a clue usually for us when someone walks in and says, I've been everywhere. I've been to all these doctors. I can't figure it out. I'm like, probably autoimmune. That's why. They can't figure it out because they're all looking at treating symptoms in their own specialty, and they're not thinking outside the box. They're just going, oh, this person has fatigue. Give them that for fatigue. This person has digestive issues, whether it's bloating or it's reflux or it's, here, take this. No one's looking at what's causing anything. And so then after the doctors are done with you, you have handfuls of pills and all these different diagnoses, but no one's actually connecting any dots. And so this is common.
We have a rheumatologist, a gastroenterologist, a this-ologist.
And so
we don't have an autoimmuneologist.
Well, that's exactly the point. When anything comes across as autoimmune in primary care, they're usually referred to rheumatology. Rheumatology or joint autoimmune specialty. They're looking primarily at RA and those things. They're not really looking at the 900 other autoimmune conditions or so that may be out there. They're really focused in on one or two or three. And it's a very conventional approach, which is still using meds and surgery and injections as primary modes of treatment. And so it's more of the same. It's just that they have a little bit more of a specialization in autoimmunity, particularly with joint autoimmunity. But for everybody else, they're kind of left out. And even in that model, if you have rheumatoid, you're basically getting an immunosuppressant drug and you might get something for pain relief, but there's no real
and just to be clear, depending on the autoimmune disease, I'm sure there are times when medications are necessary to get your body off the attack and everything. But I think what I really like people to know here is that there's a whole lot more you can do than take a medication. I know when I got diagnosed, I actually cried because my aunt had lupus and she was doing really bad. This was her diagnosis 3 years earlier than mine. And she was not feeling well, not doing well. And she had discoid lupus like I did, but had gone systemic. So then she'd been diagnosed with SLE and basically going downhill really fast. And I cried. And one of the things the dermatologist had ruled out was skin cancer for me. And he says, I've never had anybody sit in my office and cry when they found out they didn't have cancer because I had these lesions on my head that could maybe have been basal cell carcinoma or something like that. But anyway, I felt like I wanted to cry because I literally felt like I was sentenced to this life of not being able to function well. And what I really want people to understand is that there is a lot they can do to help their immune system function better, to keep it off the attack. So maybe you can explain a little bit more about how the immune system actually works. What makes it attack self-tissue? And we'll do a whole series on all the different possibilities here. We can talk about one potential trigger or another each week for the next few weeks, but can you just give an overview of that really quick?
Yeah, that's a great question because we don't have one answer to that question. That's the biggest question, is what causes autoimmunity? And it's a tough question to answer because we don't have a single answer. There's a lot of family history involved with autoimmunity. In fact, you can almost take it to the bank. If someone in your extended family has an autoimmune condition, most likely that's going to get passed down. May not be the same one, but it may be an autoimmune condition. Sometimes it's rheumatoid, sometimes it's Hashimoto's, but they run in families. We know that. So there are some genes that are more susceptible to it. There's a lot of research kind of going into that. right now. In fact, we have one autoimmune condition that we have it's the only one, unfortunately, right now that we have very specific genotypes. I'm talking about celiac disease, which is gluten intolerance. When people are diagnosed celiac, there's a very specific genetic marker that is positive, along with very specific triggers, which we know are gluten, right? And that's the only autoimmune condition where we have that level of specificity to it. And even with celiac, it can present three different ways, three different versions of celiac. The most common, obviously, and where the most research was in the gut and with digestion. So most people think of celiac as gluten intolerance. They eat gluten, whether it's on accident or on purpose, and you start to violently retch or vomit and create intestinal permeability almost immediately. And there's noticeable physical symptoms, and it's consistent and it's reproducible. Every time I eat gluten, this is what happens. And it's in the gut. Now, some people eat gluten, and as celiac, as an example, and they develop an altered gait, right? So it affects them neurologically. The gluten molecule under a microscope looks like cerebellar tissue, and the immune system and the body can start attacking self tissue because of that. And so it starts to affect balance and coordination for some people. Some people can't walk straight when they have a gluten exposure. It affects them neurologically more so than in the gut. And then
Or they get anxiety.
Yeah, exactly. That can lead to that. And then the third group of celiac, if you will, presents on the skin. Rashes, psoriasis, eczema. You eat gluten and rashes develop. And so it can really target three areas, sometimes more than one area, but those three areas are generally what are under attack. But celiac disease is really the only one that's that specific, where we have a gene pool behind it and a very specific trigger. There's factors that lead to autoimmunity outside of family history. There's exposures to chemicals. There's infections that can cross-react with immune tissue and in some cases trigger autoimmunity or at least perpetuate it. There are medical procedures. I'm talking about shots, for example, particularly the last one here with COVID, that's been shown now to trigger and deplete autoimmunity and be a cause for why autoimmunity can develop. So it's a Pandora's box. There's a lot of different causes. There's never just usually a single cause in most cases, but it's multifactorial. It's environment influenced. It's how you live your life, what you're eating, what you're not eating. It's who you're surrounding yourself with. It's family history. It's all those things that kind of go into how this develops. So when we start talking triggers, that's usually where we start to think, okay, this is probably how this started to develop.
Yeah. And my doctor told me this is genetic. I think one of the reasons that clued him that there could be lupus was because I told him about my family history. I have a lot of autoimmunity in my family history, particularly my aunt. And I think that kind of clued him in a little bit. But now you're talking about environmental factors, things like that. So there's a thing called genetics, and then there's epigenetics. And this is where we have some control. And I think this is what we'd like to spend our time talking about, because we can't do anything about what we don't have control over. We were born with genetics.
Yeah. About 10% of our 10%, 10, 15, 20%, depending on which papers you're reading, is out of our control. It's our hardwiring is what I call it. It's what our parents passed down to us. And that's information we can't change. But the good news is only 10 to 15 or maybe 20% at the most. But to your point, 80% of our genes or more is controlled by how we live our life. We're turning genes on and off every day based on what we're doing, who we're hanging out with, what we're eating, what kind of stress are we under, how are we managing that. All the lifestyle factors are really what turn genes on and off. It's like the movie Big. People remember that. Tom Hanks. It was, almost 40 years ago now. Great movie. But he's on a piano and as a kid and you see the piano lighting up. That's your genes every day, all day, based on how you're living your life. Turns genes on, turns genes off. That has more influence over your health than what you're born with in many cases. It's the other expression we use is genetics load the gun, your lifestyle pulls the trigger. So you choose.
Yep. And the medical system that we're in doesn't very often remind us that we have any kind of control over the environment or the ability to do anything about it. And as a matter of fact,
it's the opposite.
With my own research, I decided, okay, I may have a gluten sensitivity. My same aunt that had the lupus, she has grandchildren that have celiac. Okay. So I just thought, This is a long time ago before we had everything we have on the internet today and all these podcasts. But I thought, okay, I need to figure out if gluten is a problem for me. So I went gluten free, and I'd been gluten free for a couple of months, and I started noticing not only did my digestion calm down because it was a royal mess before, but also I started noticing way less anxiety, a lot less anxiety. I didn't even realize I had anxiety till it was gone. But that was one of the big things. So I went to my primary care physician and I asked him, I'm so glad I went gluten free, but what's the factor here? How come I feel so much less anxiety with being gluten free? And do you know, he didn't even explore that with me. He basically said, oh, you do not need to be gluten free. I'll give you this medication so that it won't bother your digestion. You can just eat all the gluten you want. That way you can live a normal life and it won't be so stressful. And I thought, wow. And that was even after I had already mastered it and gone off of gluten. And he's encouraging me to get back on. So my point is that your regular doctor is likely going to downplay the environmental factors that could be creating part of your symptoms.
Or ignore them altogether.
Mm-hmm.
That's the standard of care, is treat the symptom, get the patient out, treat the symptom. So what they tell you is very common. And unfortunately, primary care is 15 to 25 years behind the research. Before they implement anything, things have already been changing for a long time before they get the clue. Some of them never implement it. They don't read. They're busy. They're working with people all day, but they're not reading research. They're relying on usually what their pharmaceutical reps telling them about the medication and how effective it could be for X, Y, or Z. But it's a very common experience you just described. People go years without getting any answers. They just get more meds. They get sicker.
And it would be one thing if you could take a medication and actually start to feel better. But that often isn't the case. I mean, by the time I get a client, they've usually been on quite a few meds. They're taking them right now. And I'm not downplaying anything that may have helped them, but honestly, they aren't feeling good. And I took an immunosuppressant for a while and it made my digestion worse, number one, which is a problem for your immune system. It made me lose weight. I had a lack of an appetite. I got frail. Someone asked me if I had cancer because I was grayish in the skin tone. And so some of these medications, they have one job, and that's to either turn off your immune system or turn down inflammation. But they aren't actually helping your body do anything that it's supposed to do to help you feel better. So
no, it's suppressing symptoms. And hey, there's time and place for that too, particularly with some really aggressive autoimmune conditions that just create a ton of inflammation. It can be really hard to turn off naturally.
And you may need temporary help or maybe for a while, but let's talk about what helps besides medication.
Yeah, I think that's the realm we work in and we're not anti-medication. We want to be clear about that. That's time and place for medications. I can go both ways with that. There's a lot to be said for getting healthier, regardless of whether you're on medication or not. There's a lot of things in your lifestyle that you can clean up, whether you're taking medication or not. So those are the things we initially focus on with people because those are the things that you have control over and that actually make a difference in how you're feeling day to day. And so that's really what I think we're going to dive into in this autoimmune series. Each episode going forward for the next few weeks, we're just going to dive in on a different trigger of autoimmunity, things that you may have not even been aware of, or we haven't looked into it deeply enough. And that might be the missing ingredient, if you will, for what's going on with you in terms of your own symptoms and your own journey on health.
Yeah. And just to give an overview of some of the things we'll be talking about, a lot of food sensitivities happen during when I had a lot of food sensitivities. I didn't even realize it, but when I was able to address it, I found out that was a big trigger for me, which probably meant I had leaky gut too. And I've cleaned that up. What are some of the...
which comes back...
Yeah.
Immune system.
Yeah. And then there's a lot of other triggers. And he was talking about environmental triggers. Are you talking about sleep? Are you talking about...
Yeah. Environmental triggers are things like living in a moldy house, working in a moldy building for work, living environmental exposures. Mold is one. That's a common one. We see that a lot.
Oh, yeah.
A lot of folks have co-infections where they may have one infection and then we find out they now have been living in a moldy environment the last 2 years, and that's just exacerbating everything else. So an example would be, environmental exposures, mold, metals, body care products that you might be using, thinking they're benign, your teeth, right? Oral health, chemical exposures, environmental toxins, plastics, environmental fumes, things like that can trigger the immune system or weaken it or perpetuate the autoimmune disease or things like that. And then you also have in the world of infection, right? You have a lot of different types of infections that can weaken the immune system. In some cases, it can trigger an autoimmunity or perpetuate one. So we look at infections. We look at chemical sensitivities or environmental toxins. We look at things like stress and how it's impacting you physically, physiologically. There's things like the foods you're eating. Certainly, foods that you're eating can react with your immune system. Your blood sugar. Are you on extremes? Are you diabetic on one end? Or are you low blood sugar on the other? Or are you on this roller coaster where most people live? Destabilizes the immune system. It causes more inflammation and discomfort for people. So those are the types of things. Sleep. Certainly, if you're not getting enough sleep, that is a trigger. You need to heal when you sleep. So a lot of people don't sleep well. So those are the types of triggers that we'll dive more into because those are the things that you have some control over and you can change. And then you can.
Yeah. And then sometimes when you have changing hormones, like during a pregnancy or menopause,
right. Hormone,
that can be another trigger that can set things into motion.
That's a big one.
Yeah.
Yep. And usually that can all be happening when someone walks in the door. We'll see a woman in her mid 40s. The average age of perimenopause is around 43. So they're going through that stage of life and they have all these other symptoms besides that. So what we call sometimes a hot mess. And so that's common. I have chronic pain. My hormones are going crazy. I have symptoms with that. I feel tired. I feel brain foggy. My digestion is not great. And it's all wrapped up. And so that person could come in on 5-10 medications because they've been seeing a specialist for this and a specialist for that. And they've gotten a medication for this symptom and a different medication for that symptom. And so nobody's actually sat down and go, look at this whole picture and let's figure out how to get you well.
Yeah. And then on top of the fact that they're that age and in perimenopause, they also have a couple teenagers in their house at the same time.
Yes. No stress there, right? Just extra cherry on top. And I know that feeling really well now. So.
Yeah. So that just kind of just impacts your life in a big way. And so what we'll be uncovering over the next few weeks is what you can do about each one of these triggers and how they provoke your symptoms or create a flare up or initiate autoimmune problems. And we'll just be diving into that in more detail in the next few weeks. And most importantly, you get to do something about it. You do not have to live like this. So that's our message today.
Most important.
Yeah. All right. It was great to talk to you today, Justin. We'll see you next time.
Same here, Michelle. We'll see you guys next time. Thanks so much for listening. We're really glad you're here.
If you're feeling stuck, overwhelmed, confused, or just tired of not having answers and you know something's not right, just know there is a reason and there is a way forward. You don't have to keep guessing or figure this out on your own.
If you're ready to start getting real answers and understand what's really going on in your body, check out the links in the show notes to learn more about working with us.
And if this episode helped you, be sure to follow the show on your favorite podcast platform or subscribe on YouTube and share this episode with someone who needs to hear it. And just a quick reminder that the information shared in this podcast is for educational purposes only and is not a substitute for medical advice. We always recommend working with a qualified healthcare provider to determine what's best for your individual needs.
We'll see you in the next episode as you continue to take control of your health.